She's working from home, but she set it up where she could do the. There's Eric. Sorry, I told him to come early and I didn't leave him on very long. Are you there,
Eric? Yes.
I can hear you, but I can't see you.
Okay, let me.
We got to see your smiling face.
All right. I suppose I have to be, in view today.
Okay, we're Doug and gotta remember to record this. Y'all please help me remember to hit record. There you are. Hello. Hello.
Hello.
Tyler here, Doug Walton, and Mayor Coleman are here. Tyler will have to move the camera around a little bit to get all of us in here. This room is kind of weird, so I've tried it several different angles, but we'll get that going. I need to let all these people in. Hang on a minute here.
All right.
Okay, so yeah, I will just kind of tell you when we get everybody in and we can hopefully see. Admit all. Okay, there's Marie. I told her we were playing Freaky Friday today. We're switching. She's gonna be me today. Okay, hi Lindsay. Hello, everyone. We'll get started in just a little bit. We're letting some more people off, and as soon as everyone will, we'll let Eric kick it off for us.
Yeah, we'll see how that goes, Kim.
Great.
You might have to hold my hand. Sound like that.
I don't fuss because I do that.
And can I introduce our guests, I guess, immediately or as soon as we start,
Did you get
or what?
that I sent this morning?
What was that?
Meeting notes that I sent this morning to you?
Yes.
Okay, yeah, we'll just kind of follow that where you'll call it to order and then we need
All right.
to do the minutes and everything.
Okay.
And we'll introduce them. Hopefully we'll get a few more on here. Doing a presentation, if somebody's waiting to get in, so we'll go down there. Sure. Just click it and say admit if you. Hey, Eric, we've got a few participants on here. We've got a few more that will probably join, and I'll admit them in as we go along. So if you want to go ahead and get started, we can do that.
All right. I'd like to call the meeting to order. Thanks everybody for joining us today for the GMMA meeting via Zoom. It's good to have everybody here. I guess the first order of business is to consider approval for the June 17th meeting minutes. I'd entertain a motion for approval. If any of the normal members like Brian or Matt or Lee.
Yeah, this is Brian. I'll make a motion to approve those.
Okay. Do we need a second on that, I suppose?
Yes, we do need a second.
I can second that.
All right, thanks, Matt.
Yes.
All right, so with that out of the way, I'd like to introduce our speakers today. We have Tyler Evans, the Director of Emergency Management with the City of Muskogee, Doug Walton with Muskogee County Health Department, and Marlon Coleman, our newly elected mayor. Thank you, guys, for being with us today, and congratulations, Mayor Coleman, on your recent election.
Thank you.
It's good to have you with us, and we appreciate your time. So I guess, Tyler, you're up first. So
Sure. And I'd like to see if we can share the screen here with you guys and figure out where I need to go real quick here. So what I'd like to do is kind of go over some information for you guys. So you guys know where to go to get the latest information related to COVID. That way you guys can make decisions, for your company and for your businesses. And in my opinion, the best place to get that data. So that's what I'd like to go over this morning with everybody. There are currently 85 active cases from the data I've got in Muskogee County and 63 for the city of Muskogee. So if you go to the coronavirus.health.ok.gov, it'll bring you to the main page right here, and it'll tell you the latest update for the state of Oklahoma. There's currently a little over 28,000 confirmed cases in the state of Oklahoma. If you scroll down here, they usually update this a little after 11, between 11 and noon usually, and you can see the date that's reflected here. It's been updated today. They did that about 20 or 30 minutes ago. And this gives you a kind of a brief overall look at the state of Oklahoma. But what's a little bit more useful, we've got graphs and charts down here. We can hopefully see the trend coming down here for the number of cases reported here. Over here on the right, our red line being the number of confirmed cases, our green being our recovered cases. So we're hoping, obviously, these two lines will eventually meet, which means that every person that's got COVID has recovered from COVID. So we watch that trend going up. What might be a little bit more useful for your particular jurisdiction, if you keep scrolling down here to the blue tab, you'll eventually run into, you can view data by county, and you can view data by the city. Click on one of these, it'll open up a new page for you. and it'll have it in usually numerical order of the number of confirmed cases. You can see Oklahoma County and Tulsa County being the largest there at the top. And if you scroll down a little bit, you'll find Muskogee. So they're showing 288, and that's cumulative cases. So this is since we've started testing back in March on the number of positives that we've had from Muskogee County. We're up to 16 deaths. And over here in the right-hand column, the recovery, I believe, is 210. I can't see because of the Zoom deal here, but I believe it's 210 on the recovered. So that shows the number of people that has recovered from COVID-19 since this has all started. Like I said, you can exit this. You can click on View Data by City. And it'll even break it down by city for you. The city of Muskogee, we're at 210 total cases, 12 deaths, and it'll show you the number recovered there on the right-hand side. I believe it's 135 is the latest data I have. I can't see because of the Zoom deal, but this is a good place to go to kind of get an idea of where the standing is for your particular jurisdiction or what you want to be researching. So another point I was making, I was talking about the number of active cases. So how we gather the number of active cases, right? We take the total number of cases, which is the 210, you subtract the deaths out, and you subtract the number of people that have recovered from COVID-19, and that should give you a pretty good understanding of how many active cases of COVID-19 you currently have in the community. And as I say, the latest number I had was about 63 for the city and 85 for the county. I'd like to share, there's a couple URLs on this page here, the coronavirus page that you can go to. One I'd highly recommend, it's got a lot of good information, and it is the executive order report. So you scroll down a little bit, you find the additional data. The executive order report is available right here. And I'll start talking about some other information as far as hospitals are concerned, the number of PPE that we have on hand, so on and so forth. But if you keep scrolling down, this actually talks about the, a big topic that we talk about is the number of ICU beds available, the number of operating beds available, so on and so forth. So like I said, this is updated daily, and this shows our bed availability for Oklahoma, currently at 19%. For ICU beds. And I think that's went down 1% as of yesterday. The medical surgery beds yesterday was at 24%. So it's went down just 1% between today and yesterday. But like I said, this is changing every day. So if you go down to this PDF they publish, it's usually 1 day behind. And you can click on the PDF here, and they summarize it for you. And there's a lot of good information in here. They talk about the hospitals, the percentage of beds available, the testing capacity, the number of tests that they've conducted. And then we start talking about the COVID-19 figures, the number of deaths, the number that is recovered. They break it down by ethnicity, gender. And then some of the stats, some of you guys may hear me talking about in council meeting. This is where some of this data comes from, right? The average age of a hospitalization is 61 years of age. The average age of a case not hospitalized is 38 years of age. 78%, a little bit more of that, has some type of comorbidity such as diabetes, heart disease, lung disease, so on and so forth. So like I say, these numbers change every single day. I think we went down about 1 percentage point, 0.1 out of a couple of these. I seen that when I updated my sheet from yesterday. So there's a lot of good information here that they publish. They also go into the number of all the testing facilities, how many they've tested, how many they've reported, so on and so forth. So it really gets very detailed very quickly. So I wanted to share these two sites for you guys. Yep, we'll admit Tom in. Share these two sites for you guys so you can start gathering your own data and looking at your own research. So this is another site that the emergency managers look at. It's not a publicly available website, but I did want to show it to you guys to kind of give you an idea of where we're at. They do have some really good graphs on here. So this is the timeline from where we very, very first started COVID-19, way back in March. The number of positive cases there in the red, as you see, it is starting to absolutely skyrocket. And if there is good news out of this, that luckily the number of hospitalizations have remained, it is increasing, but has not followed the path of the red line, I guess is what I'm trying to say. The number of deaths is also increasing. Is there a way to move this by chance? Oh, there we go. I just drag it out of the way. There we go. But as you guys see, this thing is skyrocketing up here, and we are getting a number of hospitalizations that's increasing. So to touch on that real quick, talking to our health department friends and St. Francis, hospitalizations are increasing, and what we're seeing is a change in demographics, right? And one of my big questions is, well, why is this increasing so much and the death rate really isn't? Well, the demographics are changing with the coronavirus as we're learning that younger and younger people are getting sick from COVID. It's affecting the younger population a little bit more. So they may not be requiring ICU status, but however, they're having to go to the hospital. And according to our contacts at St. Francis, they're actually having to stay in the hospital longer. They're not as sick. The acuity isn't as bad, but they're sick longer. So, instead of being in the ICU for 3 or 4 days and being discharged, apparently they're staying in the hospital for possibly 2 weeks, 3 weeks on a general floor before they can be discharged. So it's kind of interesting to note the change in demographics. Like say, you see on the news about the party rollers and the beaches in Florida, so on and so forth. Younger people are getting it and they're having to go to the hospital. They're just not as sick, but they're sick longer. Another chart we can look at is the new cases here. As you can see, we are going up in the number of new cases, and the hospitalizations here in the blue is also going up. And this is a daily count here. So it's something that we're watching very closely between us, the county health department, and our healthcare community friends. So this is something we watch daily. And we run into the running average. I thought was a pretty interesting thing. The number of cases obviously every week is going up. So I started looking at the yellow, which is our deaths, right? The running average has been 6 deaths. There's 4, I'm trying to manage this mouse here, 4.3, 4.1, and 3.6. So we're looking at, 3.6 at 4.3. We go back here to April. I was looking at the average here. We're at 8, 6.7, 8, 7.4, 7.9. So one of my questions was, hey, why is the rolling death rate here lower than what it was back in April, May? And it was a change in demographics that were affecting the younger community more than we are the elderly population at this time. So like I said, this particular site is not open to the public, but the coronavirus website that I showed you guys, you can obviously get a lot of good info there. I was also going to give a shameless plug to a couple of Facebook websites you guys can go to if you're not following. Is one, the Muskogee County Health Department Facebook page. There's a lot of good information you can get from there as far as when testing is going on, if you have to have appointments when they're doing the drive-through testing, if they're going to have mass testing, so on and so forth. That's updated pretty regularly, and I'll share information from there. But if you can go to the City of Muskogee Emergency Management page, that is a page that I run personally for the city, and this is where I update the data that I share at council. So the same data that I pass out to the council members and read from is posted here on that Facebook page. And I'll tell you some of the percentages. Like I said, this was Monday's percentages. And it's just more information for you to better learn, how it affects your business in your community. With that, I think my presentation is for the most part done. Are there any questions that anybody has for me?
Tyler, is there any sort of, do you have any comment on any sort of plan for if the state does run out of ICU beds or anything like that?
Sure. So yeah, they have a couple of different hospitals. 3, there's one in Tulsa. Is it Baptist Hospital up in Tulsa? OSU is another one that they have available at their disposal. And actually the third one on the list was the one here in Muskogee. they're off Harris, that they could open up in case there was an overrun for our hospitals.
Okay.
So,
Very
yeah,
good.
the state does have a plan, and like I said, they've addressed that way back in April or May on what they're going to do, and I imagine that probably hasn't changed much. And actually, Doug, do you know if one of those have opened up or not?
I really don't. I know that they have.
I'm not sure they've actually implemented or opened one up quite yet. I don't know if the need has arisen, but there is a plan just in case the number of ICU beds become scarce and we start seeing a need to have more beds.
Okay. Thank you, Tyler. Does anybody else have any questions for Tyler?
Okay.
Take that since everybody's microphone is off. That's a no. So, all right. Next up, we have Doug from the Muskogee County Health Department.
Okay, thanks, Eric. Got a few slides to show you all, and so I'm the coordinator for the TSET Healthy Living Program at the Muskogee County Health Department, which is really kind of focused on eating better, moving more, being tobacco free. But as employees of the county health department and really the state department of health, we all have different hats that we wear for emergency response. So I've been serving as the community liaison, really just trying to share information about what's happening both the state and county levels through the COVID response, and then interacting with our other partners and stakeholders, city emergency management and St. Francis and county emergency management, EMS, and everyone else that's responding. So I'm not an occupational health expert, and really just wanting to share sort of current public health guidance and some links to resources and just information that you may already have or may not. I'm really going to be focusing primarily on sort of how this may be affecting your employees and sort of how to respond when you have employees that test positive or have been exposed or may have been exposed. And then also just some preventative measures. And I've got some links that are in my slides, and I've sent PDF versions to Kim that she can forward out that'll have those links that should be live, so you can go and have access to any of this information that you want to kind of follow up on. So kind of getting right into it, whenever you have an employee that tests positive, you have to kind of start by asking whether or not they have symptoms. And if they do have symptoms, then they need to be isolated at home. And if they're sick enough to be in a hospital, then some of these sort of protocols may vary. But for someone that's at home with symptoms that's been tested positive, they need to basically stay there for at least 10 days since the symptoms appear. And also at least 24 hours without a fever and without taking any fever-reducing meds. And also no other symptoms or other symptoms have improved. They just recently reduced the time without fever from 72 to 24 hours. It happened just on Monday of this week. So that's a recent change CDC has made in the protocol that will definitely impact you all. And then if they haven't had symptoms, then you're just dealing with the isolation since the test, and that's a typo there. I'm sorry. It should say at least 10 days since they had been tested positive. So that's really fairly straightforward, but there's a lot of nuance that kind of comes out, and the link there will really take you to the specific exact wording of the protocol from the CDC that you can use and the HR can use to make the decisions. One of them, about if they've been hospitalized and if it was a serious case, CDC says it may need to be at least up to 20 days since first appearance of symptoms before they should be released from isolation. And that's something that a healthcare provider can also help with in coordination with your, occupational health or whoever you have kind of running this. So if you have employees that are exposed, and I'm going to kind of split this out into non-critical and critical infrastructure, because I do know that we have some manufacturing in Muskogee that is considered critical, essential by the Department of Homeland Security. And you can see the list of those, if you haven't already, at that first link on OK Commerce. We've got the current list of all of those designated as critical infrastructure. But for non-critical, basically, if someone believes to have been exposed, and that's a designation that it's fairly specific, and it has to do with having had close contact with someone that was a confirmed case. And the definition of close contact is within 6 feet for more than 15 minutes. And that's the way the process really works is once someone is confirmed with COVID, then they're contacted by the health department, by the county health department, our nurses and others. We have National Guard helping. We have other disease prevention specialists who have typically worked on AIDS and other diseases that are helping do contact tracing. And they'll contact anyone that's been positive, and they'll go through a process of identifying, helping that person identify anyone that they had close contact with up to and including the 2 days prior to first feeling symptoms. And then those people will be contacted and be notified that they are a close contact to a person with COVID. And so there still may be someone that suspects it, and if they do and they haven't been contacted, they should still probably, it's best to follow this protocol if they believe they've had close contact with someone that's a confirmed case, even if they haven't been contacted. But when the system is working, they will also be contacted to be notified they are a close contact to a person with COVID. And if they are, then it's 14 days after that contact for quarantine. And while they're in quarantine, they need to maintain distance as much as possible from others, which can be very difficult in a home setting, and then self-monitor for symptoms. And the second link there will give you really kind of more details about the quarantine and some differences between quarantining and isolation. But basically, quarantine is for someone who's been exposed, and isolation is for someone that is a confirmed case. So within critical infrastructure, there have been allowances that have been made to allow continuation of operations. And so basically, a person is allowed to continue working if they have been exposed to someone that's a close contact, or if they are a close contact, if they don't have symptoms. But they need to be pre-screened, and this is where I know many of you are doing this, monitoring temperatures and asking about any symptoms upon arrival to work, and then just regular monitoring throughout the day and having everyone informed about what to be looking for symptom-wise, wearing masks, face coverings or shields, social distancing, and then disinfecting and cleaning workspaces. Those are kind of the things that need to take place if people are working that have been exposed. And then really kind of without probably needing to say, if someone does become sick and symptoms do develop, if they're at work, they really need to be dismissed immediately. Workspaces where they've been needs to be cleaned and disinfected as soon as possible. And then ideally, being able to kind of gather that information on who else may have had close contact at the facility with the person who may end up being a confirmed case. You won't know that, and they will need to get tested. And that's a kind of an additional process. We do testing, I meant to say earlier, we've been doing daily testing free at the county health department since March. The criteria, the requirements for being tested have changed. The sample kits have become more and more available. Now we're doing drive-throughs from 8:30 to 10:30 a.m. No symptoms are required. Anyone can come and be tested. And if they do have symptoms, then we can also do a rapid test. Again, the link there will give more information about those details. And then just really kind of the things that can be done ongoing that many of you, I'm sure, are already doing and very familiar with. And wait on the passing fire truck, sorry. And that I feel certain are more experienced and knowledgeable about than I am. But just within the workplace, doing those things that can be done whenever possible to keep the distance between your employees, whether it's protective shields, barriers, changes in flows, etc. Increasing that frequency of cleaning and disinfecting in places where people work together. The screening, promoting proper hand hygiene, whatever can be done to make that as easy as possible. And then, of course, reminding and encouraging sick employees not to come to work and making that as easy as possible, even though I know that that's difficult for everyone. Providing those coverings, shields, and other PPE as needed. And then really kind of thinking through sort of longer term, what happens if we do end up with a continued surge and you lose enough staff to affect operations, and then really kind of this assessment and control plan. What are you individually going to be able to do to kind of keep a handle on it within your facility? And that link there will give you a lot of details about all of that. And then really just some other resources. The top three, or really the top two from the CDC. Really some great practical information. The strategies for manufacturing facilities, a lot of what we talked about, but in more detail. Tips for manufacturing employees to protect themselves and coworkers. And then a whole string of pages OSHA website on control and prevention of COVID. And then the last one is the site that Tyler provided from the Oklahoma State Department of Health with all the data. And really with that, I'd be happy to take any questions.
Hi there, Doug. This is Brian Lanham with Acme Engineering over here on York Street.
Yes, hi.
Hey, just a couple of quick questions for you. One is your comments on the rapid test versus the more, I guess, standard test. Is there any, you hear all kinds of stuff. Is there any difference in accuracies?
Well, they seem to be ever increasing the accuracy of the rapid test. It started off with some pretty poor results on false negatives and does seem to be getting better. We're actually collecting 2 samples every time that we do a rapid test and doing the rapid on one and sending the other to the state or other lab for the standard testing to just kind of double verify. And we've only had 2 come back that were actually positive, that had read negative on the rapid, but we were able to catch that. So yeah, it's correct that some of the rapid testing was initially less accurate, and still probably is not as accurate as the kind of more standard lab analysis.
All right, and then secondly, it's just more of a comment, I think. One of the frustrations that we've had here at Acme with our people, we run close to 300 employees, and so we're having a lot of folks in different scenarios, whether they feel like they've been exposed or high risk or what have you. But as these people have gone to the local physicians, and a lot of them use different physicians, not all of our people don't go to the same place. We get notes back from that physician with recommendations, and man, there's just really no consistency. You'll have some doctors that'll that'll recommend and order a 14-day quarantine, all the way down to some, we've had a note with 3 days, and it did, and everything in between. It's one of the frustrations for us to really know and have confidence that we're doing the right thing for the employee.
Yes. Yeah, it's not the first time I've heard similar comments, and you know, I can definitely understand how frustrating it would be, and I think it's just another, you know, indication of what happens in a pandemic when it's never really happened before, and there's, you know, every day is a new day. I mean, there is solid, pretty consistent, although it does change and gets updated, guidance through the CDC that I know, you know, many providers rely on, and that's what we recommend for sure at the health department. Is, you know, that's the source, and when they make a change in protocol, they're good to notify what's been changed and why, and provide a list of the evidence. But it's really it's hard, I think, for everyone, because you know, it's ever changing, and not many have had practice in how to respond.
Right. Yeah, I agree. Thank you.
You're welcome.
Doug, what's the turnaround time on the standard tests that you send off? And do you prioritize those based on symptoms?
We really are not able to prioritize them. They're 3 to 5 days is the time frame that we're basically required to tell people. We've had them come back in 2 days. We've had them take 6 or 7, and it seems lately, the really last couple of weeks, it has slowed down somewhat, the turnaround, and it is pushing closer to 5-6 days. You know, the lab resources, I think, are just, you know, getting as stretched as imagined, and there are a number of labs that are running tests. There are only a couple or 3 that are running for the health department, and a couple of them are out of state, and we've had to switch them. You know, I don't think we've had, other than the public health lab in Oklahoma City and OSU and Stillwater, you know, we've used 2 or 3, 4 other labs that we've had to change to every 2 or 3 weeks because they run out of capacity or whatever. So 3 to 5 days, normally under good conditions, is what we're telling everyone.
Okay, thank you.
Yes.
Does anybody else have any questions for Doug?
Yeah, Doug, this is Tony Hopkins with Georgia Pacific.
Yes.
My question is kind of centered around, is there anything that we can do as a company to kind of coordinate with the health department? Say if an employee reports to us that they've had a positive test, would you want us to communicate that with anybody at the health department? Would that kind of help your situation out at all?
Well, possibly, but to tell you the truth, Mr. Hopkins, it's normally your employee will learn they're positive by someone at the health department. You know, that contact tracing process, every time any provider in the county, through their lab, whatever lab they're using, identifies someone that's positive, it is then reported to the health department for us to contact that person to let them know they are positive. And then from that point, we go through that contact tracing and the case investigation, identifying anyone who they may have been in close contact with and notifying them. So it's really probably not going to be especially helpful to do that, even though we appreciate the offer and the intent. But it's, and I want to help you in any way that we can, but I think that's probably one way that might not end up, you know, saving time or energy.
Well, we do the contact tracing too. Whenever we do get that, actually, when we put somebody out on symptoms, we start doing contact tracing so that we have it if we do get a positive test. So working with you for the contact tracing, would that help out at all? Or is that typically done between you and the patient that had the positive test, regardless of that?
Well, that's a good question, and actually, it's one that we might want to connect you with our lead nurse, who runs the contact tracing, because there may be some gap in there that I'm not really that sure about that could be addressed, and I don't want to say yes or no. So I'll get with Kim to get your contact info and get you connected with our nurse manager who's doing the contact tracing. You can ask her specific questions about your situation and if there's some way to, kind of coordinate better.
Okay. Thank you, Doug.
You bet.
All right. Anybody else?
Doug, I have a question. This is Marie.
Hi, Maria.
How are you?
Good, thank you.
Particularly with school starting back soon, and I have a personal, tie to this particular question, Doug. If your child or another member of your family has come in contact with a positive case, is it necessary for you to quarantine also, or just the individual who had the direct contact?
Well, it's a good question. In a family situation with, especially a child, and if it's, just to clarify, in your instance or your scenario, is it the child who was the close contact?
Correct.
Yeah. So, the most precautious way to handle it is that you assume the parent is, because they've had close contact with the child, then they are, or at risk if the child is likely to develop symptoms and be, confirmed. It's the household connection is one that's really difficult to manage public health wise. We don't do and aren't able to really do a very great job of it. Just in the U.S., I'll just say in general, and the way that some of the countries that started early with the worst problems and the greatest growth, the way they controlled that was they were able to actually isolate patients from their families in wards, and they converted all kinds of empty facilities, motels and dorms and barracks and all kinds of things to help care for people who were sick, and so they didn't have to stay with their family and infect their families. Sorry, it's a long answer, but really it's a hard thing to avoid, and I think most cases the parent would be considered a close contact and have to basically, quarantine in the same way that the child would.
And Doug, as a follow-up question, and again, as it relates to the reopening of schools, how does contact tracing work, and how will it work in the case of an outbreak or just a single positive case within a classroom?
Right.
Again, my personal experience, Doug, is I was never contacted.
Right. Well, it's a good question, and I think it's a new question. I mean, it's at least for there have been other instances of disease outbreaks that require contact tracing through schools and other facilities where it's limited. But it is something that I really don't know the exact answer for you, Marie, other than, if there's someone who is confirmed positive in a school setting, they're going to try their best to identify everyone who was in close contact with that person. And so therefore schools, I know, are going to be trying pretty hard to minimize close contact. And that's a big part of the process of reopening, is how is it that you can hold classes and any other school related activities without having close contact, and it's going to be difficult, but that, you know, and so in cases where there was, when things are working properly, then all of those people would be identified as someone that would have been a close contact with whoever's got the confirmed case. It's kind of an academic answer, I'm sorry.
Thank you.
You're welcome.
All right. Thank you, Doug, for answering those questions. And next up, we have Mayor Coleman. Tell us about what's going on with the city.
Let me say good afternoon, everyone. And I want to take this opportunity to reemphasize, if it's not been said enough, that the city of Muskogee, along with a large majority of its population, have nothing but thanks to the GMMA for what they do, particularly remaining resolved to support Muskogee with their businesses, with their organizations, and by doing whatever they can to keep their employees safe while we manage and navigate ourselves through this process. So let me take that opportunity to first thank you for what you do. On this past Monday night, what the city did was accept a recommendation by our joint city-county task force that strongly encourages all residents to wear masks, and it also encourages those businesses around the city that wherever possible, where social distancing is not possible, that they might encourage or be encouraged to have their employees wear masks as well as their patrons. Having said that, the key word to the entire resolution is encourage. The reason why we took the approach to say encourage is because for most cities around the state of Oklahoma, a mandate is largely unenforceable. And the problem that we face in cities the size of Muskogee, as well as other comparable cities, is that when you say mandate without the mechanism to be able to enforce, you then create a situation where citizens may feel like it's their job to enforce something against people who are not wearing masks. That can create a chaotic situation where rather than us as a community working together to fight COVID, we fight one another and allow COVID to be victorious. And so we're doing what we can to be certain that we keep people safe by allowing residents as well as businesses to exercise their due discretion to do what we can to make people safe. Of course, the argument across the country right now is whether or not to mandate the wearing of masks. And right now we're erring on the side of appealing to our residents as well as to those business owners to do what they can to help us to do that on a voluntary basis because we have no legal way to actually enforce it. And so from that part of the conversation going forward, what we're considering doing is partnering with our businesses around town as part of our previous mitigation plan to say to organizations, please share with us what your mask policy may be if you have one in place. The reason why that's so important is because if we do have an event in Muskogee that requires us from the state level down to take a stronger action, we want our businesses to already know what's coming down and have had the opportunity to plan for that in advance. As the numbers continue to rise across the state and across the country, we don't know what to expect day to day, either from our state health department or from our federal officials or those at the CDC. And so we're doing everything we can to be certain that we prepare for it in advance and have a proactive approach that's soliciting support versus requirements, because we do believe that that's going to go a longer way towards being certain that we keep our community safe. And so that's the gist of what I wanted to say to everyone on today, that we are doing what we can under insurmountable circumstances to lead in a time where there's no precedent. And if there was a precedent, it was over 100 years ago, and those people are long gone. And so we're doing the best we can to manage in a small municipality to keep our economy afloat, to keep people safe, and to save lives. Because at the end of the day, what the city of Muskogee is about is not trying to overregulate or use government as a weapon to make people do anything. but to use the resources that we have as a government to keep people safe. The other thing that we're doing as a community, we have authorized the city manager to purchase a mask, a face covering for every resident in the city of Muskogee. The reason why that's important and the reason why that's a doable option is because if we're going to ask people to wear face masks or face coverings in public, we want to do what we can as good partners with them to invest in our community to be certain that they have the resources to be able to do that. We live in a community that is not inherently wealthy. We have a large transient population. We have a number of our residents who are renters and not homeowners. And we are also faced with a number of residents that don't have the sustainable income because of what's going on with COVID-19. And so what we have authorized the city manager to be able to do is to be able to purchase face coverings and masks for every resident of Muskogee, because it goes hand in hand with our commitment to ask people to wear one. And not only will we ask people to wear one, but we'll provide it for them, which to my knowledge, no other city in Oklahoma has done that. And so we think that that's a really good opportunity for us to go to show good faith, not only to the business community, but also to their employees, as well as to the general population of the city of Muskogee. And having provided those comments, if there are any questions for me, I'd be happy to have them at this time.
Thank you, Mayor Coleman. Does anybody have any questions? Comments, Brian?
Yeah, I just have a quick comment for you, Mayor. Brian out at Acme. And before I start, just congratulations on your election and you coming on board here at Muskogee. I know you've been a long-time council member, and just thank you for your service. I will just tell you, just for your information, I don't expect an answer or anything like that, but I will just let you know that one of the difficulties that we seem to be having right now at Acme is finding employees. And I know that sounds crazy, but when this thing first started, we didn't have much of a problem. It was going along pretty well. We use, out of our 300 employees, we use about 40 what we call temporary employees through staffing agencies. That's how we bring people on board. We let them work for 90 days. After that 90-day period's over, they have an opportunity to be a full-time employee. But nonetheless, right now, we work with multiple staffing agencies here in town, and they're unable to even send us clients as of today. So just FYI, just so I don't know, I'm sure you're connected to other manufacturers. That's just a challenge for us. I'm not sure what the reason is, but it's something that we need, that we're going to have to address in our own creative way here in order to keep us moving through this summer.
Thank you, Brian. And I think that part of the reason we're having that difficulty, you all are having that difficulty rather, is because when the government decided to do the unemployment stimulus checks the way they did, one component that they probably should have considered was the welfare to work policies that were initiated during the Clinton years and then strengthened under the second Bush, because those welfare to work revisions were designed to help people who had a need, but also remind them that they needed to also be actively pursuing employment. What I'm hearing from a lot of the staffing agencies is that it's more difficult to find people because they are more comfortable living off of those $600 stipends than they are going back to work. And I will tell you that talking to some of my counterparts in other cities, not just in Oklahoma, but also in other states, that's a problem that is really dismantling industry's ability to find employees. And so we're working with the U.S. Conference of Mayors to draft legislation to, at least to our senators here in Oklahoma, that says to them, we do believe that people should get help, but that we've got to fix the back end problem that has been created, which is that it's difficult for industries to maintain employment now, because many people, they figure I can get more money staying home than going to work, in combination with being afraid for their lives, they're going to choose to stay home. Well, that doesn't do anything for the economy. That doesn't do anything for manufacturers. That doesn't do anything for cities like Muskogee, who are appreciative of having those industry jobs here, but may face closure because they can't find the workforce. And so we're trying to address it the best way we can. There's no simple answer, no silver bullet, but we have heard that concern, and I'm hearing it from you again, and we appreciate it. But we're doing everything we can to try to address it.
Great. Thank you. Appreciate that.
And thank you both for that comment. And if I might, and Mayor Coleman, I'll be sharing this information with you via email shortly, but to provide some flavor to that discussion in terms of numbers, at the county level in March, we were at a 3.4% unemployment rate. In April, that jumped to 13.1, and in May, we're back to 10.9. Again, from 3.4 to now 10.9. The interesting part of that, and I think we'll go towards Brian's comments, is that we have not only begun an initiative through the Greater Muskogee Manufacturing Alliance called Muskogee MFG Jobs. It's a social media campaign. Every Friday, we are posting job openings for our area manufacturers with a goal to connect those job opportunities with job seekers. We have also started an initiative through our Muskogee Forward Economic Recovery Task Force, in which we're tracking job openings throughout the city and the county. Currently, we have over 17 manufacturers that are currently trying to fill positions, and more than 120 overall open positions within the city. So again, a 10.9% unemployment rate and over 120 job openings. I guess you can kind of do the math.
Yep, thank you, Marie. Does anybody else have any questions or comments for Mayor Coleman, since we have the opportunity to have him here? All right, then on to the next item of business, which is there's no old business, and so new business. Does anybody have any news about their businesses they'd like to share with the rest of us?
Eric, if I might, this is Marie again. I would like to share with everyone, and you might hear some kids running around in the background, but the Port of Muskogee was recently announced that we were awarded a $4.9 million EDA grant. This is tremendous in terms of we will be able to utilize this grant money to raise the elevation of a track at the Port of Muskogee, as well as develop or construct a levee ring around the north side of the port. And so, you know, the tracks at the Port of Muskogee, given the port infrastructure there in terms of barge, rail, and truck and transloading abilities, those are definitely our most marketable tracks, not only within the city, but within the state as well. Unfortunately, as a result of the flooding events that occurred last year, those properties are now less marketable. So this EDA money will not only allow us to raise those tracks above what the elevation that did succumb to flooding last year, but again will allow us to construct a levee ring that again will not only mitigate future flooding events for those particular tracks that we're looking to develop, but also for the investments that have already been made, not only by the city of Muskogee in terms of the water treatment plant and the batfish, but also the investments by OG&E, who has a substation that was impacted last year, and Valorec, our largest lessee at the port. And so we're excited to move forward with that project.
Great. All righty. Thank you, Marie. Does anybody else have anything they'd like to share? Okay. All right. Well, then everybody mark your calendars for the next meeting, which will be on August 19th, when Lieutenant Governor Matt Pinnell will be the guest. So that'll be interesting, and be looking forward to asking him some questions. Kim, is there anything else we need to cover?
I think that about covers it.
Okay, then I guess we're adjourned for today. Tyler, Doug, and Mayor Coleman, thank you very much for joining us. We really appreciate being able to ask you guys questions and having you participate with us. And we really highly value the relationship that we have with our local leaders and people that run the government. So thank you guys, and congratulations once again, Mayor, on your historic election.
Thank you.
We're looking forward to working with you.
Thank you.
Thank you, Eric.
All right. Thanks, everybody. And we'll see you next time.
Okay.
Thank you.
Thank you.
Thank you.